And now I'm here with Tom Kertscher of PolitiFact Wisconsin, who has done plenty of fact-checking for us on healthcare claims. So, Tom, we've got one from Paul Ryan,
right.
And that is basically looking at a report from the Nonpartisan Congressional Budget Office, which he said confirms that the American Care Act will lower premiums. We rated that half true.
Yeah, half true because it's partially accurate. So what Paul Ryan was referring to is a report that was released, a government report that was released on Monday. It got a lot of headlines because it estimated how many people will lose health insurance if the Republican replacement for Obamacare becomes law. So
Isn't that about 24 million?
Right,
was that it?
Right.
By 20...
About 10 years out.
Yeah.
Right. And sort of in counter to that, Ryan, pointed to another part of the report and said, hey, premiums are going to go down. What he's referring to is the report does make estimates for people who buy health insurance on their own, the individual market. And what the report says is that if the Republican plan becomes law, in the first 2 years, premiums for those people will actually go up 20 to 25%. And it's not until the period from 2020 to 2026 that those premiums will actually be lower as compared to Obamacare. What the report says is premiums for individuals are expected to be about 10% lower than they would have been if Obamacare remained in place. So we rated it half true.
And would that be presumably maybe after people have stopped using it, that it could be maybe a healthier pool? Is that part of it?
Yeah, the report cited several different reasons, but one reason that it's expected to go down over time is that they expect more competition, for example, in the marketplace, and more healthier people, if you will, buying in.
Okay, well, I'm sure we'll have more to fact check on that one because Paul Ryan's been talking about this a lot.
That's right.
So next up, we've got Tammy Baldwin, and she said Trump Care would allow insurance execs to personally make millions of dollars off of your health care. We rated that one mostly false.
Mm-hmm. Mostly false for PolitiFact is something that has an element of truth only. And she's correct in that the Republican replacement plan for Obamacare does provide a tax break to healthcare companies that would be worth millions of dollars. But it's important to know that that tax break is for the companies themselves. It's not for the individual executives with those companies. And we don't know, there's really no evidence to indicate how the companies would take advantage of those savings. So if they got a tax break, would they just sort of add that to the bottom line? Would they make other improvements in their plans? And obviously they could also give raises to their executives, but there's no way to know whether that would actually be millions of dollars or not.
Maybe that one will be one to revisit later to see who, if they get.
If it goes in place, right. That's right.
Okay, the next one, we've also got Donald Trump, and he said 1/3 of the counties, think of it, 1/3, only have one insurer left on the Affordable Care Act exchanges, and we rated that one true.
We rated it true. People who follow PolitiFact or PolitiFact Wisconsin closely know that the president has not a very good record on the truth-o-meter in terms of statements that we rate as false or mostly false.
He's doing pretty well, pants on fire, yeah.
Yeah, he's got a lot of those. But in this case, we rated this statement true. Whether it's the president or other Republicans, they've criticized Obamacare in a number of different ways, and one of the most recent criticisms is that, hey, health insurance companies are dropping out of the marketplace. And based on a study done back in November by a nonpartisan organization, 1/3 of the counties in the country have only one insurer that provides health policies on the marketplace. So in other words, if you want to buy health insurance on your own and you want to take advantage of subsidies provided by Obamacare, in 1/3 of the counties in America, there's only one plan to choose from.
So I guess that would be less competition in that marketplace.
Competition, and for the consumers, less choice. If you want to take advantage of Obamacare and get some subsidies, you'd probably prefer that you had some choices out there. But in 1/3 of the counties in the country, there is only the one insurer. A lot of companies have dropped out of the marketplace.
Okay. Got it. Well, we'll have to have you back soon, as there's a lot of talk about healthcare these days. So
Great.
Thank you so much.
You bet.
Thanks.